All right, good afternoon, everyone. I want to welcome you to this webinar this afternoon. My name is Adidayo Adiribigwe. I will be Programs Manager for Nigerian Solidarity and Support Fund, NSSF. We want to thank everyone for coming and attending this webinar today. So this webinar is, like we all know, is a biannual event of the Nigerian Solidarity Support Fund, who is a non-profit organization. We use this webinar to educate our community, a lot of Nigerians, partners, and stakeholders. We choose topics that are engaging and can stimulate conversations. For this webinar, we'll be looking at maternal interventions in Nigeria. Is there a synergy or is there a segregation? We're trying to appraise and to see what is happening in the maternal health space. And of course, we have our seasoned panelists that will do justice to this topic today. The moderator for this event, who I'll be handing over to shortly, is Dr. Babatunde Adewumi. He is a founder of Quinta Health, an organization that deals with prevention of cervical cancer in Nigeria. He will be moderating this event. But we also have in this event a seasoned obstetrician and gynecologist and the MD of the Lagos Island Maternity Hospital, Dr. Femi Omololu. Let me just say right now that one of his favorite pastimes is he has a nickname. He's always called the dancing doctor. Yeah, he has some of those skills. So you're welcome to this webinar, sir. It's a pleasure to have you. In this webinar, we also have the representative of the SOGON, which is the Society of the Obstetrician and Gynecology Society of Nigeria, Professor Azubike, who is supposed to be here, but he had to catch an urgent flight, who is in transit as I speak. So he sent Dr. Charles Umba to represent him. You're welcome as well, sir. Thank you. We also have a seasoned journalist who is going to be also sharing her thoughts with us. Her name is Ms. Zainab Yekin. She's host of a favorite show on Wazobia FM called The Maternity Line. She's with us and she'll also be sharing her thoughts with us. So that we don't waste so much time, I want to hand over to the moderator to handle this event, and we look forward to an engaging webinar. Thank you so much for coming, and let's enjoy the session. Thank you.
Thank you so much, Dr. Adiribigbe, and I really want to appreciate the opportunity to host this very, very important webinar. Maternal mortality is one of the major challenges that we have as a nation. And when we talk about maternal mortality, it's also something that we use to measure the health system of a particular country. So if the health system of a country is good, the maternal mortality will be quite low. But in a country where the health system is ailing, just like ours, and we have so many challenges battling our health care system, the maternal mortality is on the high side. I recently attended a conference, and we're talking about the maternal mortality of Nigeria, and somebody was like, can I just break it down for her in little figures? Because I said the maternal mortality ratio is 512 to 100,000. And I was trying to like find how I was really going to break it down into little numbers, because she was like 512 to 100,000. Probably that is a low number, but I had to now compare it to other countries who barely have maybe just one maternal mortality to 100,000, and then that was the moment she realized how very important this particular topic is. And we have people who are here who have been on the field, and people who have first-hand experience in handling this issue and have been working in this space. Those are the people who are going to be talking to us today. And I'm going to briefly just read out the profile of everybody that's here. It's actually very loaded. The profile of everybody who is here is very, very loaded. So in no particular order, I will be reading out the profiles of our speakers today. I will be starting with Dr. Olufemi Omololu. Dr. Olufemi Omololu is a third generation medical doctor from the Omololu family in Lagos. He obtained a Bachelor of Medicine and Surgery degree at the College of Medicine, University of Ibadan, 92. I don't know where I was then. In 2004, he obtained the fellowship in the West African College of Surgeons through the University College of College Ibadan. He was appointed as a consultant obstetrician gynecologist at the historic Lagos Island Maternity Hospital in 2006 and was instrumental to establishing postgraduate residency training in obstetrics and gynecology in the faculty as a director of clinical services and training in 2010. He was appointed medical director at Lagos Island Maternity Hospital in 2019, a position he occupies till date. He has also obtained leadership trainings and certifications from the University of Washington and Lagos Business School. He is vastly experienced in general gynecology and obstetrics with special interest in gynecological endoscopy and medical education. He is also a fellow of the International College of Surgeons. He is skilled in leadership, customer service, strategic planning, and is an enthusiastic human professional development leader. Dr. Olufemi Omololu loves to write, and he is an author of 2 books and several articles in various magazines. He has blogs on general issues and sports. He is also a music connoisseur and a sport enthusiast. He is also the founder of Doctors in Arts, a movement that seeks to help doctors get in touch with their artistic instincts. He is married to Mrs. Ibitomilayo Omololu, and they are blessed with 3 children. So I'll go to the second one. Professor Azubike Onyebuchi was over 5 decades ago born to the family of late Sir Micah E. Onyebuchi and Lady Felicia Onyebuchi in Umaya North of Abia State. He's currently the medical director, Federal Medical Center, Umaya, where he also brought tremendous infrastructural change and market improvement to service delivery in the hospital before his appointment as he was a senior lecturer in the Department of Obstetrics and Gynecology in the Ebonyi State University at Abakaliki, Ebonyi State. He was also a consultant, special grade 1 at the Alex Ekweme Federal Teaching Hospital at Abakaliki, where he served as one-time CMAC. He was elevated to the rank of a professor of obstetrics and gynecology in April 2021. He is a fellow of the West African College of Surgeons, fellow of the National Postgraduate Medical College, and a fellow of the International College of Surgeons. He's a member of the body of examiners of the West African College of Surgeons, a Faculty of Obstetrics and Gynecology, whose responsibility includes certifying doctors to be specialists in obstetrics and gynecology. He's currently serving as the faculty board member representing Southeast Geopolitical Zone in the Faculty of West African College of Surgeons, Obstetrics and Gynecology. He's also the current Secretary General of the Society of Gynecology of Nigeria, having served as Assistant Secretary General for years. He has published over 65 journals in reputable international and local journals and still counting. He has also contributed to knowledge by writing chapters in 10 textbooks and has co-edited a textbook of obstetrics and gynecology currently in circulation in Nigeria. Prof. Onyebuchi is an associate editor of the Journal of Basic Clinical Reproductive Sciences. He's also a devout Christian and a knight of the John Wesley Methodist Church of Nigeria. He has served 2 terms as lay president of Abakaliki Diocese Methodist Church. He's happily married to Dr. Mrs. Amarachi. This part is one of the parts that caught my attention. They are blessed with 5 children, and the last 3 are triplets. So indeed, a professor of gynecology with that master stroke ending. All right, so Zainab Yekin is a broadcast journalist currently working with the Nigerian Info FM Lagos. She hosts the Maternity Line show, first of its kind on the station's program schedule. ML unearths realities of motherhood through unique stories and in-depth conversation on reproductive, maternal, newborn, and child health services in Lagos and Nigeria as a whole. For the past 5 years, Zainab has been a producer for primetime show Morning Crossfires and now Borderlines, tolling the path of advocacy for children and better healthcare systems for women after 7 years of her professional career was a conscious effort born out of passion for spearheading conversations on radio to enlighten, educate, and encourage stakeholders to do the needful. Maternal Line has seen the likes of SA to the President, President Tinubu on Health, Dr. Salman Ibrahim Anas, Office of the Commissioner of Health, ably represented by the SA to Sanwo-Olu, Dr. Kemi Ogunyemi, foremost Nigeria's fertility consultant, Dr. Abayomi Ajayi, and a host of others. To top her certifications, Zainab just finished a short course in nutrition, health, and environment at the Lagos Business School, courtesy of Nestle, Nigeria, where it concerns Nestle, Nigeria, where it concerns child health and the women. There is no stopping now. It gets better when the right approaches are indulged. That's Zainab's mindset, and that is a very beautiful mindset and a very amazing way to actually cap up the profile of the amazing speakers that are here. I'm sure this is just an abridged version of these profiles. There are so much more to these amazing people that are here to speak to us, and we will be listening to them and hearing from those who are working on the front line and at the fore of reducing maternal mortality in Nigeria. As you can see, it's an array of speakers from the administrators down to the people who are helping us in the media to talk about this. So we are going to be delving into the conversations very shortly, and we'll be starting with Dr. Femi Omololu. So good afternoon, sir.
Good afternoon. How are you? Thank you.
Thank you for being here with us. So we want you to just share a brief insight into what LIMNH is and what you do in terms of providing care for women. Because one of my friends actually did his house job in your hospital, and they actually always sing your praises and how you handle the proceedings in that hospital. So can you just give us a brief insight into how your daily activities run in that place? Thank you, sir.
Okay, so Lagos Island Maternity Hospital is a secondary care facility at Lagos State, where we provide specialist care in obstetrics and gynecology, and also for inborn neonates. So essentially, we don't take babies born outside, but babies who are born inside. Within the hospital, there's a neonatal ICU, intensive care unit, where we handle them. We also do gynecology, because our name tends to deceive a lot of people thinking it's just maternity we do. We do gynecology as well, where we provide care in oncology, diagnosis, primary care of treatment for, and also prevention for of cancer. And then we also do a lot of endoscopy presently with our gynecological services. Of course, it provides some allied maternity care like immunization and family planning as well. We are also a training center because we moved into postgraduate residency training in the year 2010 for obstetrics and gynecology. And we're also involved in postgraduate training of anesthetists, family care physicians, and pediatrics. So it's also a training center. We have medical students who come to us from the Eco College of Medical Sciences, Luth, and as well from Luth, and also from various nursing schools all over the country. All over this, well, outside Lagos as well. So don't let me say not just restricted to Lagos. And we're also the major referral center for obstetrics and gynecology cases within Lagos, because we get referrals from all over Lagos, being one of the major referral centers. People get referrals from LASUT and also from youth occasionally. So we are very busy. We are popularly called the Baby Factory, and we have up to about 250, an average of about 250 deliveries per month, with a cesarean section rate of about 48%. Our maternal mortality rate over the years has varied. Before we started the residency training, it was at about 9,000 per 100,000, which is scary. But over the years, we've been able to bring it down to about 900 per 100,000, which is a hospital-based figure. Also taking into consideration that we are a major referral center. So our daily activities involve seeing patients in antenatal clinic, taking deliveries, seeing patients in the gynae clinic, taking deliveries, and managing patients within the ICU. So I think that's a good enough overview of what we do here in Lagos Island Maternity Hospital. Thank you.
Thank you so much, sir. That's quite robust. When someone hears Lagos Island Maternity, probably the only thing that comes to mind is that they only give birth to children there, but this is just a very, very robust service that you provide, and it's looking like a very big powerhouse for maternal and child health. Thank you so much, sir, for all you do. Now to the representative of Prof. We wanted to just share a brief insight into what SOGON is and what they do, especially in the areas of maternal care, policies, and intervention.
Okay, thank you, Mr. Moderator. Permit me to recognize the distinguished obstetricians that you had earlier mentioned and all the co-panelists. Let me begin by saying that Professor Onyebuchi Azubike is the current Secretary General of Society of Gynecology and Obstetrics of Nigeria. So he is in a good position to talk about SOGON and the vision and mission statements of that society. Unfortunately, the exigencies of duty took him away, and I was called up at short notice to do that on his behalf. I hope I put my tiny legs into that his very big shoes. The Society of Gynecology and Obstetrics of Nigeria is an umbrella body gynecologists practice. Of course, we have over 9,000 gynecologists and obstetricians that have been trained locally and internationally, and who practice in Nigeria or for some reasons have just left the shores of the country. The SOGON was formed in 1965 and was incorporated with the Corporate Affairs Commission in 1999. The whole idea is to bring together all the practitioners in the field who are involved with the promotion of maternal health and prevention of maternal morbidity and mortality into a union where ideas will be shared, statistics will be shared, visions will be uniform, and then work will go on as a team to the society on women's health generally, as well as reduction in maternal and newborn morbidity, as well as mortality. Mortality meaning death of either mother or newborns. The society also achieves this through advocacy, programmed activities, and obstetric practices in tertiary hospitals in the country. The members of SOGON are examiners at the colleges that train specialists in obstetrics and gynecology. They are practitioners in teaching hospitals who attend to women and children. They are also practitioners in federal medical centers and other specialized hospitals where services that has to do with dealing with women in pregnancy immediately after delivery and taking care of the newborn is offered. Essentially, the core values of the association is to achieve a women-friendly care, have respect for rights of women, respect providers' rights and needs, especially for the trainees, ensure uniform and high ethical standards for obstetric practice. This is one area of practice where disputes can arise and occasionally you have some litigations. So the society ensures high ethical standards, maintains quality, and ensures that whatever we practice, there's some level of transparency and accountability, because we sit to discuss the statistics, like you mentioned, the 512 maternal deaths in 100,000 live births, even though the figures appear to be higher than that with the recent statistics. So the society has members spread across all the zones, as a matter of fact, all the states, and is divided into zones. And each zone appears to be relatively autonomous, holding its own activities, but accountable to the national body. Professor Nyebuchi belongs to the Southeastern Zone. I belong to the Southeastern Zone as well. So in summary, the SOGON is an umbrella body that takes care of training of specialists, regulates practice of obstetricians, and brings these obstetricians and gynecologists together to share ideas on not just how to reduce maternal morbidity and mortality, but also how to improve on women's health in general. So let me end it for now for purposes of time. Thank you.
Thank you so much, Dr. Mbachals. We really appreciate that. And I must say that in my fight to against cervical cancer in Nigeria, SOGON actually played a huge part. I attended a training in Abakaliki, the Federal Teaching Hospital, where we were taught how to do visual inspection with acetic acid and Lugos iodine. And that was one of the things that actually equipped me and helped me to begin my fight against cervical cancer. You also mentioned that we have 9,000 obstetricians and gynecologists that has been trained and has passed through SOGON. Maybe when we have time, I would try to ask that maybe how many of them do we have in Nigeria and how many have Japa syndrome taken away? Thank you so much, sir. All right.
Thank you.
Dr. Zaid, okay, maybe I'll give you MBBS by the time we are done today. So, Zainab, can you just tell us about your role and what your programs have been about? I would like to know what exactly your program is all about and the roles that you have played. Thank you.
All right, thank you so much. Good afternoon, everyone. Thanks for having me. I would love to correct Dr. Aderibe, who said I am a journalist with Wazobia. It's actually Nigerian info. Although Wazobia is our sister station, so it's okay. But then just to correct, I am with Nigeria. So yes, with about 8 years of professional career, 6 years of live broadcast, creating, engaging, and informative content on radio, and of course, over 4 years of motherhood, which actually inspired Maternity Line, my show. I've had to interview many people, experts, doctors, midwives, lactation consultants, single mothers, pregnant women, with unique stories now. And I believe that by investing in the well-being of mothers and children, they're shaping a brighter future, right? So with regards to my activities on the Maternity Line, of course, my activities have been centered around the tooling part of advocacy for better care, for better healthcare system for women and of course childcare, which of course Mr. Dr. Adelupe mentioned earlier, it's a passion, conscious effort, one out of passion for empowering mothers, caregivers, guardians, with knowledge, resources to prioritize their health, which is very, very important. And I see that when I started this show about 2 years ago, of course, I've been on the radio for over 8 years, for about 8 years now, and of course, broadcasting for about 6 years. Started with Cool FM and all of that. So, being Nigerian people, I saw that not many radio stations in Lagos are doing content around maternal health. And because, of course, I am a mother myself, I became a mother about 4 years ago, yes. So I saw that there was the need to keep discussing, to keep highlighting, to bring out the problems bedeviling the maternal health care system in Nigeria. So I went ahead and I came up with this idea, So I create the same space for honest conversation, possible, exploring topics that matter to parents, women in this context, women and sometimes men, fathers, So I enlighten them, encourage others for better informed choices. How do I do that? I don't do this alone because, of course, I'm not an expert. I will try my best advocating for better health. So I bring this expert to talk about that. And beyond making use of my passport, the funds I have to create awareness about ranges of issues, that affect women and girls in their adolescence, that with regards to the girls, I encourage women by amplifying their voices. And we went as far as creating a special telephone line, for women to call in. So the number of women that call into the show. I did not come up with that idea. It was the senior colleague who more active with it, just so you know how passionate they are, about women health and children on Nigeria. So we came up with that, and I started spearheading conversation, that tackle a range of issues, from antenatal, prenatal care, parenting paths, mental health, nutrition, justice. And lately, I've been exploring critical issues like child sexual abuse and how to seek justice and support society. Also, on the way is a check on pregnant and nursing mothers' image, and their babies in the Nigerian correctional services to know how we are parenting. So largely, Maternity Line show, of which I am the host, is not just coming on air every week to highlight issues that affect women with proper solutions by bringing experts, professionals, to talk about it. And sometimes I'm beginning to do more of that. I try to bring government officials who are the forefront of this issue, who are the advisors of of leadership, president, governors. So in order to have conversation around this and how to put a solution the way forward. So I'm excited to explore specific aspects of the topic that we're discussing today with fellow partners, right? An appraisal of Nigerian child care intervention, synergy, or segregation. So throughout the discussion, I think we delved into key points, and I'm eager to hear diverse perspectives from both fellow partners and our audience. So let's try as much as possible to make this conversation engaging, insightful for everyone to participate in, and for solution involved.
Thank you so much, Zainab. And you can see the flair and the courage of a journalist in you, and I see the passion with which you talk about these topics. And it's not just a topic for you, it's more like you trying to solve a problem, and that is what we are looking for: people to collaborate with doctors who are working in the hospital, health workers who are working in the hospital, to amplify the voices and to also bring about a change. and a solution to the country. So maybe one day I will be on your show to come and talk about what I love talking most about, which is cervical cancer. But until then, let's continue with maternal mortality. So I'll be all right. So I'll be going to Dr. Femi Omololu now. From your experience as the medical director of arguably the busiest maternal hospital in the country, what are some of the general challenges that women face that leads to poor maternal outcome? You know, we talk about all these delays that happen to women in what's it called, in accessing care. So what have you noticed? What is peculiar to women around you that come to the hospital that now makes us now feel that you can now tell us that these are the peculiar challenges that women face? Are you there, sir? Dr. Femi?
I think it dropped off just as you were getting
Asking
your
the question.
in. So can we move
okay.
to Sogon?
Yes.
So
All right.
while he joins us back.
All right. So Sogon, Dr. Mba. So
Back.
as
He's back.
okay. Dr. Femi, are you with us?
Please, let's go to Dr. Umba. Dr. Femi's mic is not active at the moment, so while you sort that out, please.
All right. So Dr. Mba, let's talk about the role of SOGOM as a leading association in Nigeria on issues relating to women's health. Can you just share your experience?
Confirm you can hear me. Sorry, it seems we're having some network issues. I can hear you, but you're breaking up a bit.
Okay, we'll come back to you, sir. Dr. Mba, can you hear us?
Yes, I can hear you clearly, okay. although it's raining quite heavily in Abia State at the moment, but go ahead.
Okay, all right. So as a leading association in Nigeria on issues relating to women's health, can you just share your experience on how maternal interventions have been synergistic or vertical in approach? So are we really working together or not? Like, is it like we have individualistic programs and people are not working in sync? It's not in synergy. So can you tell us from your experience in Sogon?
Okay, thank you. Sogon has been at the forefront of advocacy as well as strategies to reduce maternal mortality since inception. If we look at the current maternal mortality rate figures of 814 per 100,000 live births as at 2019, and if we look at the 3 levels of delay as described by Tedros and Marine, where they talked about level 1 being delay in making decisions to assess appropriate comprehensive obstetric health center, assess care from an appropriate center. Level 2 being logistics and delays in reaching that health center. And level 3 being receiving appropriate and immediate care on arrival at the comprehensive obstetric health center. If we look at that, you find that Sogon has tried to key into those 3 levels to see how to achieve that reduction in maternal mortality. As for the delay in making decisions, the strategy is to increase advocacy by engaging the media. I'm happy we have a media person here. By engaging the media, the print, sharing leaflets. Each zone organizes outreaches, often free. In my zone, we had a cervical cancer screening, like you mentioned, powered by Sogon recently. And then we've also had an outreach for gynecological surgeries, and also free antenatal care services in certain designated government hospitals. And so by increasing advocacy, more women are knowledgeable and can take decisions by themselves. The other issue in reducing that level 1 delay is in trying to encourage health workers and in tertiary hospitals to undergo training and retraining, especially in their attitude and service delivery mannerisms. Because we look at a lot of studies, the services may be there, the hospitals may be functional, but in some states in particular, the usage and acceptability of delivery in good centers, comprehensive obstetric care centers, is very low because of the general belief in the fact that the home deliveries and traditional birth attendants are more caring. So we need to do more in that regard. Sogon has been trying as well. Then for the level 2 delays, Sogon has partnered with government. Recently, the coordinating Minister of Health approved or allocated a mark 25 billion to development of 9,000 primary health care centers across the nation. The whole idea is to use the money to improve on infrastructure, train the midwives and other healthcare workers, and support them in logistics to access the health centers, and then referral arrangements, so that where there is a need, the distance between the primary healthcare center and where the service that the particular woman requires will be given, will be shortened. Then in terms of the level 3 delay, that's where Sogon comes in mainly by training midwives on almost all the procedures in obstetrics, and then training junior colleagues, the residents and senior registrars as it were, and then organizing examinations to test their skills and capabilities, and of course, admitting those who are aptly qualified to practice obstetrics in the country. The only challenge, as you had mentioned earlier, is that more than half of the number that have been admitted are currently practicing outside the shores of the country. And so when you train manpower and many of them are not available to deliver service, it becomes a little bit challenging as well. So Sogon has been at the forefront, having recognized that maternal mortality indices in Nigeria is only second to India. Nigeria contributes about 20% of all maternal deaths worldwide. That will make up just about 3 to 5% of the world population. So those figures are staggering, and each maternal death has been described by some philosophers means the end of a generation. So no mother should die during pregnancy, childbirth, or delivery. The other area is in ensuring family planning, delivering contraceptive advocacy and the services, training nurses as well as doctors on how to practice contraception safely. Then we also partner with mental health experts on how to stabilize women's mental health. The paradigm shift now is to ensure maternal wellness rather than allow morbidity and then mortality to occur. Sogon also gathers information on what we call maternal near miss, women who nearly died, they survived due to early intervention that they received. The idea is to get information from these women that will enable us to work towards preventing such severe morbidities or even mortality in future.
Okay.
So Sogon is at the forefront of all the struggles and fights and efforts in reducing maternal mortality to the barest feasible minimum at the moment. So thank you.
Thank you so much, sir. So I'll just ask a yes or no question, which I would like you to respond to. The question is, do you think that because there are so many interventions from the state government, the federal government, NGOs, individuals, you've mentioned a lot of things that Sogon is doing. There are so many interventions. So are you, can you just maybe in just one sentence so that we can move on very quickly, is there a synergy in the work we are doing, or everybody is just doing their individualized things that they feel that they should do? And is there a synergy? Let me just ask that. Do you think there's a synergy?
There's minimal synergy because NGOs take one line of prevention and then hold up in annual conference in Rio next month, because the level of synergy is very low. There's some level of synergy, no doubt, but it's very low. Most people, most NGOs, state government, primary health care, local governments, as well as the Federal Ministry of Health.
Okay, I think Dr. Mba is having some network issues. So we'll go back
to be working together to.
Okay, thank you so much, Dr. Mba. So I'll go back to Dr. Femi. We're talking about that you should share your experience with us. Your hospital is like one of the busiest maternity hospitals in Nigeria. So can you share your experience? What do you think is like the major challenge that women face and that do not make them access care? Because your hospital is a referral hospital, and I'm sure you've seen quite a number of issues, and both social and medical. So can you just share some insights with us on what you think the major challenge for women accessing care and leading to the high number of mortality that we have is, sir? Thank you.
Thank you very much, and apologies for the network issues suffered earlier. Well, we see quite a number of challenges within the system. First one we'll say is the health-seeking behavior of our women, because most women, when they are pregnant, actually do go to see somebody. But who are they seeing? That is the question. Find out many of them are seeing TBAs. They are seeing, they are going to nursing homes. They are going to, mission homes and places like that where they may not necessarily get access to quality care. And it is only when things start to get complicated that they start being pushed out to, proper facilities like Lagos Island Maternity, where they could get, secondary care facilities where they could get good care. I also realized that even when they get to some hospitals, private hospitals, and all these other places we are talking about, the care that they get there, the people they see there are not really, there's capacity deficiency among some of the healthcare providers themselves in terms of recognizing the risks that patients face in pregnancy, and then also in terms of having the skills and the knowledge to actually conduct safe pregnancies and safe deliveries. And that creates a bit of a challenge. These two things could be related to poverty and ignorance. And then, like Dr. Mba mentioned, people not, probably the attitudes that they think they face in some of the secondary care facilities where they can actually get good care. That's one of the things we've been trying to strongly address within Lagos State. Another challenge that we sometimes see is access to blood products. Because sometimes when things get complicated, to get things which you can actually use to take care of the patient tends to be a challenge. Hemorrhage is still one of the leading causes of maternal mortality. Although for us here in Ella Maternity, because we have a center, we have a blood bank, and then we have a Lagos State Blood Transfusion Services depot within the facility. So it's not such a problem, but they still have challenges getting blood to fulfill the needs everywhere. So voluntary blood donation, continues to be a challenge to make availability of blood and blood products, which will actually stem the tide of maternal mortality. And I think one of the biggest challenges we really face on the floor is that of the poor referral system. Because by the time patients get to us, they are exhausted financially, even health-wise. The condition of the patient has severely deteriorated because you find that they've gone to 1, 2, 3 places before they can get to where they can get good care. It's not only Ella Maternity they can get good care, but that's one of the challenges that they face. So there are weak referral systems, whereby patients are going from one place to the other before they can actually get good care, and that causes a delay, like Dr. Mba mentioned, type 2, type 3 delay in terms of the kind of care that the patient can get to reduce maternal mortality. So these are some of the challenges that we face on the ground. Basically, not getting access to people who are skilled to take care of their care, going to places where they cannot get good care, seeing healthcare practitioners who lack knowledge and capacity, and then a weak referral system. These are some of the things that we see creating challenges, because talking about maternal mortality, over 90% of those patients, at least within our facility, who actually die and have severe morbidities are the patients who are not registered formally in Lagos Island Maternity. For those patients who register here, pregnancy is likely to be uneventful without any major challenges, but it's when they are coming in from other places that we see a lot of these challenges. So the challenge of access to very good care, I think, is still one of the major challenges we face. Thank you.
Thank you so much, sir. I really appreciate the insights that you gave. But you mentioned primary care, you mentioned secondary care. I would want to add that primary care is actually one of our major problems when it comes to healthcare in Nigeria, basically because the primary care is supposed to also have some maternal and child health components before they even get to the secondary care. And you have rightly actually mentioned the fact that there's a problem of referral, which is one of the biggest headache that I have in the medical system in Nigeria. Thank you so much, sir, for your insights. So I'll go to Zainab very briefly. You have had lots of engagement on maternal and child health advocacy. So what are the important points that you have seen in your experience that contributes to this poor maternal health outcomes that we have? Can you just briefly share your experience? Thank you.
Thank you so much. Just as Dr. Charles and Dr. Omodolu have said, one major thing I see is lack of access to quality health care. And this is what I mean when I say lack of access. Maybe not lack of it, maybe inadequate, yes, to quality health care. Our healthcare standards are poor already. And apart from the shortage of health personnel stemming from Japan syndrome, massive exodus of healthcare professionals. Also, when pregnant women go to the hospital, they're going to experience number one, because I've had first-hand experience. And one of the reasons I started this show after having my baby. I was in the hospital for close to 4 hours in public facility, and then something that could pass for an emergency. And I was there for hours. Even the attitude of healthcare workers in this context, not doctors, maybe nurses and some others working within the hospital premises were not encouraging at all, because you have to stand in line, you have to queue, you have to sit for long. So that something like that could discourage women from going to the hospital. And when you have to wait for a very long time before you are attended to, somehow you are not getting quality health care, even if they're going to be attended to an end. So now you look at that, the poor attitude of some health workers towards patients, the long waiting hours at the facilities, and then how effective is the health service you are getting? How effective is it? You get, because you don't really have so much money on you in the context of people, having to struggle to go to the health facilities. You don't have enough for you, poverty, right? So apart from lack of access to quality, you're looking at poverty and economic constraints is one. Limited education and awareness is another thing. And I'm glad Dr. Iba emphasized that a lot. Sometimes women, because they don't have the right education in this context, they don't have the right message, you don't even listen to radio, you don't even watch TV. They will just, if their friends recommend that, you could easily visit a TDA around, they go there because they don't have the proper knowledge, they don't have the right education to go to this secondary health facility, right? Also, inadequate support system is another issue that we have in this part of the world. If you very much unlike other developed climes where people, mothers, women, people generally have access to healthcare, timely response, they are being catered to. In this part of the world, we don't have such support, and we're trying as much as possible to hold our government accountable to this in order to get things better. Then, when a woman has a baby, perhaps she comes down with certain health issue, people begin to stigmatize her. I've been saying it in my own, what is it called, my own language, Yoruba, oh, she must be suffering from mental health. So, malnutrition is another major issue that we need to look at. There are many more points to highlight, but because of time, it's very important we look into issues of lack of access to quality healthcare, awareness, education, and social and cultural determinants. These are some of the challenges we need to address.
Thank you so much, Zainab. You harped on some very salient points which borders around the social and the social demographics of the patient and the social determinants of health when it comes to these patients, because a lot of them, the hospitals are actually probably available to them. For someone who is in Lagos, for instance, now, the hospital is available. And for some of them, it's not like they do not have the money to access this care. Some people that, okay, so I had a woman who came into a hospital where I was working in like maybe 5 years ago, and we told her she was going to have a CS. She refused to have the CS, went to a prayer mountain, and then eventually came back. The child was dead in her womb for maybe say 3-4 days. And by the time she was coming, that was the first time I was going to vomit on operating table. I was a medical officer then. I vomited on the operating table because of how bad the smell is. I know Dr. Umba and Dr. Omolulu would know what I'm saying. It was bad. She lost her uterus and she was in the hospital for so many days. So many days. So these are some of the things that we see. And for some people, these points that you have mentioned, the influence of people from home telling them you should not have a CS, you should not listen to what the doctors have said. Like Dr. Molulu said, you should go to faith homes. And I want them to even cancel faith homes and start arresting them as personally because of some of the challenges that they cause. But then we'll still talk about some of these things as we go on. So I'll go to Dr. Femi. Can you just tell us from some of these experiences that you had, if you have to pick top 2 priorities of the things that you are going to solve, which is going to be your top 2 and why, sir?
Picking straight up from where you left off, my first priority will be in terms of regulation. Because when you talked about canceling faith homes, I mean, I think that's where the challenge is. Because if you look at the discussion we've had, one of the major challenges it's in terms of access. There are 3 pillars you are talking about when you are talking about healthcare management and prevention of maternal mortality. You are talking about access, you are talking about affordability, you are talking about quality and access, affordability, and quality of care. So regulation, I mean, I always say a woman gets pregnant and she wants to go for care. She just walks into anywhere close to her to receive the care. What kind of care is she going to? Can you blame the woman for just walking into that place? Can you blame the woman for going to a TB, for instance? Can you blame her for going to a mission home, for instance? I'm not sure you can blame that woman for going to those places because they exist. And if they shouldn't exist, then you can't blame the woman for going there. So we need to strengthen our regulation in terms of healthcare facilities, as in what are healthcare facilities expected to provide. There should be a certain level of care healthcare facilities are meant to provide. And there should be, so that patients don't go to where they are not supposed to be. Within the Lagos State system and within the network, especially within the primary healthcare system under Lagos State. Second, there's a very good handshake now. Because there's you can see improvements in the way patients are referred from primary healthcare centers to secondary healthcare centers. So they know their limitations. They know there are certain things they shouldn't handle. And then they now push those patients up. The challenge is like, yes, sometimes now those patients may not come to the secondary care facilities or not necessarily a public one, but where they can get good care, and then they now go back to the TBAs, and things like that. Lagos State has also trying to engage the TBAs, because we constantly engage the TBAs. We are trying to regulate them, trying to, make sure they also know their limitations and know what they can do, have a proper handshake with the hospitals in terms of sending their patients to the centers where they can get good care. So regulation in terms of care of facilities, regulation in terms of care of the health workers, because it's not okay to just say you see a doctor or a nurse. Sometimes that doctor or nurse you are seeing may still not be able to handle care, handle labor or delivery or post-delivery very well. So there needs to be, proper training and capacity building among doctors, nurses, and other healthcare workers, and it has to be structured. And we see a lot of this being done in the public sector, but in the private sector, what is being done? I know, with the JAPA syndrome, there's a challenge. You go to a private hospital, okay, fine, you will engage in training there, but the doctor you meet there in January is not the same doctor that is there by June or by December. So what are the protocol systems that are put in place? What are the regulating? Who is actually checking them and seeing that, look, what they are doing there is what they are supposed to do in terms of risk assessment of patients, in terms of knowing limitations of what they are supposed to do in terms of patient, in terms of also proper referral systems. So we need to strengthen our regulatory pathways. I think that's one of the major challenges that we face. Second one is data management and information management for me, because it's still sometimes difficult to get the picture and get the full story of what is going on within the state and also within the country. Been trying to track our maternal mortality rate in Lagos. It's quite difficult, because you have to collaborate everything together. What's happening in the private sector, what's happening in the public sector. And until you have that full story, you can't even come up with good interventions to try and reduce this maternal mortality. Your strategy is going to be flawed. Just last year, we conducted a Lagos State reproductive and child health information survey, but we use the sisterhood method, which is whereby you're asking people about people they know, which is not a very strong system. But what we came up with was even still very high at 430,000 per 100,000 maternal deaths. But what we came up with for Lagos, which was still low. What is the actual, looking at it more comprehensively. And then when we get this information, how do we disseminate it? Thankfully, we have people like Zainab here, who is doing a good work in trying to disseminate information. But we need to do more in terms of getting people to go to where they should go. Again, Lagos State government has tried, because now they've broken the districts of Lagos into 6 and tried to put a leadership structure into a stronger leadership structure into the primary healthcare system within Lagos, by putting them into 6 districts. So that way, they are going to strengthen, the aim is to strengthen the primary healthcare so that it attracts people more. Yes, there's still a lot of work to do in terms of attitudes and, even staffing, to make sure that these places are well staffed and well coordinated. But when we have those can make it easier. And then very good reporting system for information dissemination. Because we have to look at some of the things that work. For instance, there is the MPDSR program, which is maternal and fetal death surveillance and response. That is going on across all the public sector, secondary care facilities in Lagos. And it's been amazing, very amazing, where we generate information from all the different hospitals. We come up with interventions on how we are going to, reduce maternal mortality. From that, within some localities, the hospital has gone to engage TBAs around them, want to engage the PHCs around them. Remember, when we did that in Ala Maternity, we even met with the TBAs are also part of our committee, we even give them access lines whereby they can call the hospitals when they have cases. So there are some interventions that work, but that management, that information dissemination and getting it across board is a major thing. Tackling culture is very difficult. That takes time. So that one about the woman who, when you tell you she needs a CS and she goes to one mountain top, and making you vomit on the operation table, it's difficult to change that kind of mindset. But if that mountain top did not exist, it takes you back to regulation and letting that woman know she should go to the mountain top. Proper dissemination of information and letting them know the risks. Then, I think maybe we can make some headway in reducing maternal mortality. Thank you.
Thank you so much, sir. Regulation and data collection, very important, because if you don't have regulations, people will do anything they want to do anyhow. And if you do not have data, you will not know the aspect to actually intervene, which is actually very important. So these very two things are very important. So Zainab, let me come back to you and ask you to give us first-hand experiences of women that you have encountered. And when it comes to this talk of maternal mortality, let's hear from like the consumers point of view. Yes, so can you just give us some insight into some experiences or some women that you have experienced, that you have met, that have been adversely affected by the Nigerian health system, both positively and negatively? So just give us one positive story and one negative story very quickly.
Certainly, I think there are more negatives than positive. The negative
Abba. More
yes.
negatives.
No, we disagree. We disagree.
Let's know that the negative always overshadows the positive.
They are more positive.
Negative is always louder than the positive. That's the challenge.
So I agree with what you said, but because I do bring women to come on and share their stories, I've had a few of them who the facility has failed. Let me put it that way. One time I remember an emergency ambulance driver, called into the show anonymously and said, Zainab, these people need to do better. I am an ambulance driver. I want you to. She didn't mention the hospital. I am talking about someone who works with the health facility, saying that things have to be better. There was this woman who we took to the hospital, and eventually the woman died because we had to wait for the fact that we had to go to her place to pick her up and bring her to the hospital. I've had women come on the show trying to deliver their baby, and the experiences they've been sharing is not what we're talking about. At the end of the day, they find one doctor or another who was very nice to them during the whole process, or maybe during that process, someone was harsh to them. So the reason I said we have more of negatives than positive, but with regards to Lagos State, or Lagos State government or Lagos State health facility, Lagos is doing fantastically well. And I also have my research and I have statistics. I have them come on my show. I see, because I know there are many other interventions that Lagos State government has put in place in terms of, saving lives of women and children at the point of delivery, including free antenatal care services and much more. So when we say positive, we can make a reference to what Lagos State government is doing and what the beneficiaries are talking about. Although there are challenges anyway, by me, that intervention, the free antenatal and free birth delivery services are one of the positives. Now the negative. The negative, we need to, as a country, as a society, there has to be an improvement in the general care services. There has to be improvement. Because that, if you ask patient number one, patient A, she will say a similar thing to patient two, mothers, pregnant women who are on the show. So we can point fingers to what the government or maybe what the NGOs or what other activists have been doing in terms of positive, but the negative, I didn't see. In terms of negative, I see lots of negatives, but the positive, I can easily point just like the intervention.
Okay, so Zainab, maybe one thing that I would like you to do one day is probably go anonymously. You can work with Dr. Femi on this. Go anonymously to a medicine ward, right? And go anonymously to a gynecological ward in a government hospital and see what the response is like in both places. Now, most of the complaints that people have about the healthcare system might come from you will discover that it will likely come from the maybe medicine wing of the hospital. But when you get to the gynecological wing of the hospital, I can tell you for free that these people are tigers. Like the way they walk and the way they fight every other person in the hospital and in the system to ensure that things are done. I'm a public health physician, I'm not a gynecologist, but I can tell you for free that if you go to the maybe I would like maybe Dr. Femi to allow you to enter into where they do their morning review. They do morning reviews every day. The way they almost beat themselves up if there is seemingly an error. You know, when a woman dies in the hospital, and even it's not the fault of the hospital that they brought her into, it's a training center. The way they will grill the doctor that handled the case and ask him, okay, why didn't you do this? You should have done this. So I would let you know that the hospitals are probably trying their best. Most of the people who come and they have negative outcomes, like you heard what Dr. Femi said, most of the people who come and have negative outcomes come from outside with complications and expect that a miracle will be done. So this is not me supporting, but when you come to an O&G department, you would see that there is a lot of joy. But some of these negatives that you see, people loud it. There are so many things that doctors do to improvise to ensure that people get health care in Nigeria, especially the gynecologists. These guys are suffering. You want to say something, Zainab?
I quite understand you. I think we also need to encourage people who have benefited the right attitude from gynecological words and the other words that you mentioned, because most of the times this complaint, yes, still does come from medicine and maybe gynecologists. Well, at the point of delivery, you hear nurses are shouting at me, nurses are not treating me right. I've asked to ask Dr. Kelly that why the poor attitude of nurses, because a bunch of times they don't complain about the doctor. Appears as though doctors are friendly, they are more friendly people. But nurses and some other assisting persons, they tend to complain about it. So I think it's high time we encourage people who have benefited from the right attitude to start looking out. So that will serve as encouragement to others criticizing.
So I want to give Dr. Mba and Dr. Femi, let me go a little off script. I want to give Dr. Femi and Dr. Mba 30 seconds each to respond to the fact that there are more negatives.
Yeah, let me go first because I'm itching to go.
Okay, sir.
Yeah, when I took over as a medical director about 5 years ago, what I wanted to do, my main thrust was to try and change the culture within the hospital. The culture with Maternal is, particularly talking about, because see that like our patients, our doctors, our health workers actually do these services and they do it. So the plan was, how do they do it? And we came up with a lot of interventions which we used to try and do that. But then how do you monitor? How do you track? Because that's where the stories are going to come from. And what we did was that trying to key into social media engagement and what is going on nowadays. We engage our patients. We have a WhatsApp forum for our patients. When they register, we are constantly talking to them. We make sure they go on that WhatsApp forum. We talk to them. And we're getting a lot of positive feedback on those WhatsApp forums. Of course, there'll be one or two negative feedbacks. It's not all perfect. And what we've done now is to try and translate those responses from the WhatsApp forum to our Google page. For Google Lagos Island Maternity Hospital. Okay? And you go to our Google page and you look at the reviews that are there. I'm sure Zainab, you just try and do it. I'm confident to tell you that you should go there and do it.
So of course, I read a lot of reviews online. I read a lot of reviews online. But coming on radio, people don't
I get you. You see, the thing about it is like generally, people who have negative experiences are going to be more vocal. They are in the news, they are in the media. Whether it is world news, whether it is hospital news, whether it is football news, it is the negative one that is always going to make more noise than the good one. You understand? But it doesn't mean they are not good stories. You understand? And yes, we must continue striving to put down the negative news and make sure that that they are more that they are less. I think that's just it. We want to make sure that they are less. So I mean, some Nigerians and people generally, when they get good service, they are not quick to respond. They are not quick to talk out because it is presumed, it is assumed. It's like even like about taking on the doctors. I mean, a doctor who does a good job, I'm not always going to pat him on the back every time he's done a good job because it's expected of you. That's your responsibility. But when you do a bad job, they are going to come down hard on you because, hey, you have failed to meet up with where you are supposed to meet up. So it doesn't mean that there hasn't been a good job, but just that the negative comes out more. And I'm not debunking the fact that we don't have negative stories. We do. It's continuous work in progress. But I don't think it's a bit, will I say, like use the word, a bit unfair. And we need to balance our views more. I think that's what I'm trying to say. We need to balance our views more. So we'd like to, for you in the media, to also look out for those positive stories and push them out too as well, so that people know that there's actually a good side to this thing, not just bad side. Thank you.
All right, Dr. Mba. Are you there, sir? Oh, I think he dropped off. So because sometimes it's very painful. A doctor is rushing in the middle of the night looking for blood, especially the junior doctors, rushing up and down to look for blood for a patient. And then at the end of the day, he say, oh, he has not done well. Well, I think we should amplify both stories and just get a balanced view of everything. So Dr. Mba, final question for you, sir. For Sogon, are you with us, sir? Are you there, sir? Your mic muted. I can't hear you.
I'm here. I can hear you.
Okay, all right. Thank you, sir. So, if you are going to make any recommendations to the government on what the government is to do to improve maternal mortality in Nigeria, if you are going to make 2 recommendations, can you quickly just give us 2 recommendations that you would make to the government to improve maternal mortality in Nigeria? I think we lost him again. Okay, so Zainab, over to you again. Okay.
Yeah. Can you hear me? Can you hear me?
Yes, I can hear you now, sir.
Okay. Okay, so I was saying that just 2 recommendations would not be enough to improve on maternal mortality statistics because of the system that we operate at the moment.
Okay, but, top 2, sir. Top 2.
Yeah, let me just limit it to top 2. Sogon is interested in regulation that Dr. Femi has mentioned.
Okay.
There is no country where health care practice is not regulated. Without adequate regulation, you will not be able to reduce maternal mortality because you need to regulate who practices medicine, who practices obstetrics, and who attends to our women. It's very important. So we need to enforce regulation using appropriate authorities. But there's some argument of who should effect.
Are you with us, sir?
The regulation. In each state, there are issues. Hear me now? Wow. Can I be heard?
Yes. Now we can hear you.
Okay, can you hear me now?
Yes, we can.
Okay, the second issue is funding. Funding. More money has to be allocated to healthcare delivery. It's an essential service. WHO recommends 15% of annual national budgets. I looked at the last budget. About 8.3%. So because of the challenges we have on how to make the system work, it is lack of remuneration that is making the healthcare workers leave. In my center, the Federal Medical Center, Omaya, last year, 226 nurses left. 226 nurses and 50 have left us as well. So funding so that appropriate pass and similar those things have to be there. So funding and strengthening in that patients don't need to go. So Sogon is doing an appeal. Thank you.
Thank you so much, sir. So 2 points. The first very important point is regulation. Who should see patients? Is it who should see our women? Who are the people who are to see our women, and these regulations should be uniform. It should be enforced. The second one is funding. Funding is very important, and it cannot be overemphasized. Okay, so Zainab, what changes would you like to see? What improvements would you like to see? Dr. Femi would like to hear from you.
Yes, so I would like to say specific areas that we implement or to address the high maternal and child mortality rates. Efforts should be focused on discouraging socio-cultural factors. What do I mean by that? So our government needs to form religious leaders, traditional leaders, and there are three of them: religious leaders, traditional leaders, and community leaders.
Community leaders.
There has to be a way to engage them, because according to my research and according to interviews and market professions, these are the people encouraging and contributing to high maternal rates, because the people within their community, when they choose to visit the TDAs and something complicated happens in the case of what happened in the experience that you shared, what becomes of the woman child? He or she dies. He or she survives, right? In the case of the child. So these are the people that we need to approach them for more education and awareness. So these people serve as point of encouragement. Also, it's very okay. One, you said one, okay. So I don't go.
All right, thank you so much. So the engagement should be very, very good. So we will still come back to our panelists to ask them to give us their final words before we end. But we want to take questions from the audience. I was looking at the Q&A the other time, and I've seen a couple of questions. So I'm going to read the questions out, and each panelist would see which fits them, and then we'll just give us like a minute each to like respond to those questions. So I think this is for Zainab. What is the role of journalists in trying to encourage mothers to listen to health workers' opinion, especially most people who believe more in their religious leaders? Ayo says, I'm so glad to hear maternal mental health in this conversation. Kudos to Sogon. As maternal mental health advocate and practitioner, one of our biggest goals in my organization, Haven Advocacy, is to integrate mental health to routine antenatal and postnatal care. Are there any efforts in this direction? What advice or referrals can you give to us to support our efforts? Ayo Ayeni also said, that's amazing, Dr. Mololu, including TBAs and even giving them a priority access line to the hospital. How helpful has that been? Anonymous attendee, nurses and health workers are irritable. Oh, please. No empathy. Oh, wow. When pregnant women come to the hospital, could that not be contributing to why women prefer mountains or faith homes to have their deliveries? Okay, but the doctors are nice. But I don't believe that all nurses are also bad like that. You can also choose nurses, right? We know that many investments have been made in maternal and child health in the past. What do you think is wrong with these interventions that is making it difficult to solve this problem? Anonymous attendee, doctors are trying, but the system seems to be working against them. I think doctors need to also start speaking up about how the system is working against them. Okay. Is there a plan for government, Ifunaya Igweze, is there a plan for government to partner with health tech startups in maternal space to improve access to care and efficiency? So these are the questions that are here for now. So can we just answer them? Like, I think we've taken notes of those questions. So I would allow Dr. Mba to go first. Dr. Mba, are you with us?
Can I be heard? Oh. Can you hear me now?
Yes, I can.
Wow, it's raining here. Apologies about the poor network.
Oh, so sorry about that, sir. Should we
Okay,
come back
fine.
to
So,
you later?
No, let me go because I have to I have another meeting by 2:30.
Okay, that's fine.
The issue of mental health is very important, but and others, insecurity and all that, the Japa syndrome has made, I'll say 80% of the mental health experts that used to practice in Nigeria prior to this period, they've all Japa as it were, as we say. They've all left the shores of the country. So with 1 or 2 psychiatrists in my center, how do you attend to over 500 antenatal cases that come weekly? And then attend to the ones that come for prayer checkup. So that may not be very practicable. And someone said health workers are irritable. Well, that is partly true. It's part of the challenge. On Sunday morning, there were only 2 midwives in the maternity, in the labor ward of FMC Omaya, attending to 13 or 14 women in labor. With that, there will be burnout, and of course, there will be some form of irritability. WHO recommends 1 midwife to 1 woman in labor. That is not practicable, even in Lagos. Interventions are not visible because they are not sustainable. A state government or the federal government churns out a policy, implementation becomes an issue. Dr. Femi talked about records, data, and all that. Record keeping is very poor. Data collection is poor. Analysis is poor. And then using the data, well, of course, when you don't analyze the data, you won't know where you have challenges. So more needs to be done. And the EMR is one way out. The electronic medical records is going to help if we have the funds to initiate that. Doctors speaking up, yes, very important. Very important. The laws of the practice makes us a little bit restricted in giving out information. But I'm happy that a lot of police are finding a way around it, not trying to undermine the laws. By going to social media, put up anonymous posts. I have a blog, for example, the Abia Gynecologist and Obstetrician. I try to talk about my experiences in the practice on and off pitch in a way that I think would not infringe on the rights or the rules of the game. So doctors need to speak up, because those who are non-doctors, they speak up. They tell you things they cannot do that they do them. So we need to say what to offer, how we offer them, and talk about the positives, so that Zainab will not come in and say there are more negatives than positives. In my center, we've just lost 3 women.
Don't cast me. What I hear from my people, from my constituency people.
Oh, I'll stay with you. Can you hear me? Yes, so I said, so that Zainab, we need to speak up so than positives. In my center, we've had over 1,000 vaginal deliveries safely this year. Our cesarean section rate is 35.5%. I think we've had about 4 or 5 maternal mortalities. So there are few negatives, even though they're allowed. So we need to speak up and talk about the successes, and then talk about the challenges we had in those that we lost. Thank you.
Thank you so much, sir. Thank you so much, sir. So I'll go to Dr. Femi Omololu. I know Zainab has like responses for everybody, so that's why you come last.
Okay. Thank you. Someone asked about how has it been going with engaging the TBAs. Well, it started off well, like with most things in Nigeria, but sustainability after a while, and it's also because of challenges with unregulated TBA people who now, created problems for the TBA within our platform. You understand? So sometimes that now got lost. But with those through the TBAs who come for our MPDSR meetings, there's still constant engagement anytime they want to refer cases. And we've had a better handshake. And but that's just within the Lagos Island community. Because for us in Island Maternity, we see people who come from TBAs from all over Lagos. So we still have a challenge. But within the Lagos Island community, there has been an improvement. Because, for their representative to boldly come for our MPDSR meetings and actually speak there, it shows that we are making some headway. The lack of empathy, well, again, is one of the things we keep on working on. And I do think we have improved, at least in my facility. And I'll say in some of the other facilities in Lagos State too as well. Because we've done a lot of work in trying to improve accessibility to good healthcare. We have about 10 or 11 maternal and childcare centers now in Lagos State, and that has actually improved access. In fact, when they opened the one in Etiosa, our patronage in Island maternity dropped by 30%, which shows that people are now going to the maternal and child center in Etiosa instead of coming to Lagos Island maternity. And of course, with what we are seeing in the economy recently, we are seeing more and more people coming to us here. And if it was that we are bad or that people will not come, but we can't see everybody. I mean, private care still takes care of 70%, 60 to 70% of all the patients that are seen in Lagos. So, not everybody can come to public care facilities. So that with all the intervention and all what we are looking at, we have to look at it at both private and public sector. One of the values we have in Island maternity to push is empathy. We talk of respect, empathy, and professionalism. But that's to show you how strongly we take the issue of empathy and how we are trying to push it in our attitudinal change. And we are actually making some progress. Someone talked about no mention of technology. Very good statement. We are trying to improve technology as much as we can. Here in Island maternity, we use the EMR, Electronic Medical Record System, which Dr. Umba talked about. And it has actually revolutionized our care because, number one, patients' records are available at the click of a finger. Issue of missing case notes is no longer there. We're able to time the appointments and schedule the appointments better. Record keeping is better. Some delays in laboratory and with results and things like that are also better. And the Lagos State government too is, there's what we call Lagos State SHIP, which is coming up very soon. That's the State Health Information Platform, where we tend to synergize all the medical information, data, medical records, and programs and all that is going on within Lagos State to come on to onboard one platform. But with that platform, of course, different levels of accesses, people can see what's happening within Lagos State. And, for us medical people, we can also have access to, health information records from other places. 70% of the secondary care facilities are already using electronic medical records as we speak. When I mentioned the WhatsApp platform for patients, that's use of technology as simple as it is, because that's the basic form of technology which you can use to access people. And it has been fantastic because patients have been able to call in. They have access to our midwives, and some of our doctors too on that platform 24/7, where they can call them and ask them questions and get direction on how to go about their care. Patients getting notification of when they are supposed to come for appointments and things like that. That's also use of technology. Although unfortunately some of the challenges we are facing are still so basic, like things that have to do with cultural change, things that have to do with unregulated practices. And so how are we going to use information technology to address that? Like I said earlier, information management is one of the major things that we need to look at. So I think those are some of the questions which are directed at me. I hope I've been able to satisfy.
Thank you so much, sir. Thank you so much, sir. We really appreciate your responses. And I must say that Lagos State is actually doing very well. And I usually tell people that if you want to see a model for what healthcare should be, you should actually go to Lagos because of the interplay and the innovations that people bring in. And I wish that other states will do well, and Lagos would also raise the bar higher than they have actually raised it. So I would like to go to Zainab.
Yes, so it's hard to project the feedback and also getting industry done. Also, it's saddening, despite the fact that our healthcare professionals are doing their best, regardless of the brain drain, the JAPA syndrome, to hear some people say, oh, we are still not doing enough. We can't satisfy everybody, right? Because human wants things to insatiable. Right. Now, to respond to the role of journalists in trying to encourage conversations, just as Dr. Charles has said, I think as a journalist, we play a very vital role in shaping proper narrative, right? And maybe sometimes the wrong narrative, and we try to strike a balance. But it's best to, I think going forward, it's best to encourage our patients when they even come to the hospital. Let's encourage them to talk about it when they go out for care with TV, newsprint or whatever, that, okay, this is what I've enjoyed so far, other than allowing, giving room to other people who are ready to push the wrong narrative. So push out the positive stories and more is important. Also, feedback on healthcare services and ensuring voices of beneficiaries are heard is another thing to consider. Please, I'm sorry, I made our doctors feel this way, but let's also try as much as possible to encourage them to share the good feedback with the journalists. Thank you so much.
Thank you so much for those responses. We really appreciate all our speakers because you guys have really done justice to this. I was beginning to enjoy this whole session more, and I hope that we have more of these conversations, because for me, this is what gives me joy. I really always appreciate when people who have hands-on experience come and tell us how it is, not how it should be or textbook stuff, how it is, what is happening on ground, and the things that seem difficult. Let us compare notes. Okay, look at what is happening in the eastern part of Nigeria. Look at what is happening in the southwestern part of Nigeria. I think, Dr. Derigbe, next time we should bring somebody from the northern part of Nigeria so that we can like have a balanced what's it called, view of everything, because it's very interesting to know that in a single hospital, more than 200 nurses left in a year. That's pretty, as I don't know how that hospital is still managing right now and how they are coping with all these things. I would like admin to add Abubakar Imam. He was involved in a maternal and child health survey with the National Primary Healthcare Development Agency recently. So he can just give us like tidbits about their findings. Abubakar Imam, he's there. While admin is trying to add him, let's just have like our last words. So let me just say, can you just give us like action words as we are going? So just give us like an action sentence, something like, no woman must die from maternal mortality. Let us do this and that. So let me give us time to think about our action words. Is that okay? While we are trying to add Abubakar Imam so he can speak.
Abubakar, can you please accept the promotion so that you can be among the panelists to speak?
Yes, Imam, can you please accept the mic?
For some reason, he's declining it.
He's declining?
Yes.
Okay. Okay, because he was trying to share the documents with me. Okay, yes, you can speak now, Imam. Just give us like a summary of the documents you're trying to share with me.
Okay. Can you hear me?
Yes, we can hear you.
Very much for the audience. I have a bit translated this. So when I just the NDA just concluded, you know, we usually data test to get all that.
Your line is breaking. Can you? Your line is breaking.
Can you hear me now? My network is a bit.
Unfortunately, we can't hear you because it's breaking. And that would have been a very, very interesting stuff because that's the recent NDA. Can you speak? Let's hear you again. Okay, I think his network is bad. It's really breaking. Okay, so now I'll start with Zainab. Your action word for us. Your action sentence for us.
Yeah, collaboration. Let's collaborate to listen to each other.
Thank you so much. Okay, thank you so much. Let us collaborate. We can't have vertical programs. We should all meet together and work as a team. Dr. Mba.
Yes, sir. Collaboration once again. Collaboration. All the agencies, NGOs, Federal Ministry of Health, SOGON, collaboration. And if you're going to prevent maternal mortality, you need to bring in a lot of factors. Then regulation of the practice. Thank you.
Collaboration, regulation. Let's see if there's going to be a Sean from Dr. Femi. All right, sir.
Now you have put me on the spot. I have to start looking for what I wanted to say.
Please go ahead and say what you wanted to say, sir.
What's the Sean I wanted to say now? I wanted to say adoption. Adoption of what has already been put in place. Because there are so many things that are already in place, but they are not just working well and not being properly utilized. Sorry, I'll just stretch it a bit. I will not really talk about financing because Lagos State has come up with its Lagos State Health Insurance, Lagos State Health Insurance policy, and that has actually helped a lot of people helps to do maternal care, because funding is one of the things. Someone talked about people not being able to afford health care. In 2022, I mean, which is first year now? 2022, yes. We had about 165 patients who accessed care here via health insurance, Lagos State Health Insurance. 165 for the whole year, 222. 223 and 224 so far. We've had 2,033 people who have accessed care here through Lagos State Health Insurance scheme. So, and for all people who have access to care here through the Lagos State Health Insurance scheme, we've not had one mortality among them. Amazing. So what is that telling us? If people can, and they've had it, I mean, relatively free, how much are you paying? I mean, you pay a token of, you pay 45,000 for a year, and that covers you, including delivery and, primary healthcare, basic primary healthcare, hypertension, diabetes, and also delivery. So that has actually helped. So that's something that is already on ground. But when we are talking about just 2,033 people for a hospital like Lagos Island Maternity, I don't know what the general figures are, but no, it's still very small. And that's something that is already in place for government, that government has put in place to help people. So Zena, please, you need to help us promote this Lagos State Health Insurance.
Thinking about having to do on the show for some time.
So we need to do that so people can actually use what is on ground, and it helps to improve. And that's another way of providing health financing. So there are things on ground, a lot of training programs on ground, financing programs on ground, health awareness programs on ground. We just need to strengthen them and make more giant strides. Thank you.
All right, so I'm going to just summarize it and give us a code for today. So we said collaboration, adoption, and regulation. So that's a car. So we need a car that is going to take us to the destination where we are going to have low maternal mortality. And that car is collaboration, adoption, and what? Regulation. So
maybe utilization should be my Sean. Utilization.
Utilization. So you have spoiled my code already. So it's been a very amazing session for us today. And one thing is clear. We have people on ground who are willing to ensure that Nigeria actually gets to that level where we have low maternal mortality. But what we just need is collaboration between everybody. It's not just the government alone now, even though the government has a lot of burden on this. But I usually have a quote where I say that healthcare is serious business and government really has no business doing business. So these things should actually be a burden on us as an individual. And where the government should actually really come in is with the regulation of these services and ensure that people are able to utilize. So when there's adequate regulation, where government adequately funds things, the remaining burden lies on us as individuals, whether as journalists, whether as doctors, whether as nurses, or even as people who are utilizing these services to ensure that this works. So I'm so grateful for the Nigeria Society Solidarity Support Fund for finding me worthy to host this amazing set of panelists today and to have this conversation with us today. I'm so grateful, and on this case. I'll be resting my notes while I call on Dr. Adedayo Aderibigbe to give us the summary. Thank you all.
All right, thank you so much, Dr. Adeomi, for an amazing session. Yeah, it's been such an insightful 2.5 hours that we've been engaging. A lot has been said. I think that one thing I take away from this session is that doctors need to, or health workers generally, you need to say our story, so we need to sell our story more. And of course, I'll be counting on you, Zainab, to help to get that done. Your show is a platform. You're a broadcaster, you're a journalist. You can also leverage on some of the conversations that you have had here today to also help spread the message.
Also tell them to come and sponsor the show.
Okay, no problem, absolutely, absolutely. So of course, I think there are so many positives, just like Dr. Femi said, there are so many positives, but a lot of people will always sell the negative story the more. So yeah, we're looking forward to also collaborating with you on your show and taking at least having so many conversations just to promote it. If we spend 3 hours, we'll always have something to say on this topic. Is very, very, a lot of people have questions. One thing that also stood out is that we need more health workers in this country. How we're going to do it, I honestly do not know, but I'm hoping that, governments, partners, stakeholders, we need to sit down and realize that we're sitting on a time bomb. And the earlier we do something, the better, because no matter the interventions, right, if we don't have the personnel to drive the process, it's not going to be easy. It's not going to be easy. And then one thing again that also stood out in this meeting is that we need to work together the more. A lot of people are doing so many things. Partners are doing theirs. Sogon is doing theirs. But a lot of people are speaking from their own angle. I think we need to sit down, have more conversations, and as well to also ensure that we keep working together. I personally think that some of our funding options, even though I agree that we are not being funded very well, but I think that if our funding is more coordinated, if partners come together, pull resources together, I think that we can achieve better results, especially if we're working with stakeholders. And so, on this note, let me call on Linda Dong to give us vote of thanks and thank our amazing panelists, our amazing participants, and our moderator for taking out their time to engage us today. Thank you so much once again.
Thank you so much to everybody. It was such an amazing session. Dr. Adewumi, you like Gen Z was saying, you killed it. Thank you so much for Dr. I must say that you said your tiny legs could not feel props shoes. Allow me to say that your legs are anything but tiny. Then Dr. Femi, I'm sure you don't know, but Dr. Femi and I, he's my classmate actually in Business School of Netherlands. And anytime he's in class, he makes us look bad. And I'm wondering, I read management, he read medicine, why is he showing himself like that? But it's okay. And with what you're doing, Idle Maternity, yeah, it shows it's the person. It's really not Island, it's you that is in charge, that is really running the thing. So thank you for coming on. Thank you for sharing your wealth of experience and expertise with us. Dr. Zainab, you see, Dr. Ademo is right. At the end of this, we'll just give you an MBBS because you broke it down. You made it look easier for us. Doctors have a way of speaking over our heads, but you brought it down to our levels. We the non-doctors. So thank you so much, Zainab with a Y, not an I. I also wanted to apologize for mixing up your names on the flyer. Thank you, everybody. Thank you so much for joining this session. It was so insightful. I was just taking notes. I'm like, wow. Thank you. Thank you so much for such an enriching. We're definitely smarter for logging into this. Thank you for collaborating with NSSF. Thank you, Dr. Adeomi Car, CUR, anyone. I think it will work. We now know it, top of mind. We're just so happy that you guys were with us this evening, and we know that everybody has learned a lot. Thank you so much. Thank you. On behalf of NSSF, I'd like to say thank you. We'll definitely collaborate more. That's the word for the day. So expect us next time in your inboxes, in your DMs, asking for more. That's how we are. Thank you so much.
All right, thank you so much, Linda. I want to appreciate all of you, and I want to wish us all a great evening and a wonderful day. Thank you so much. Have a good day.